Well, hello, and thank you very much for joining us. My name is Grace Lai. I'm the Managing Director at Periop Partners, and I thank you for spending this time with us to investigate more about this new style of doing business. I'd like to acknowledge the contributions of Dr. Aaron Lecomte, my co-founder at Periop Partners, and his work already in the thinking, the design related and the computing associated thinking of how we can approach a better designed healthcare system. Of course, we wouldn't be here without our customers and the support of our partner network. So an acknowledgement to our partners for supporting us as we go forward inside this area of aged care services, and as they help us understand this new emerging technology and the impact on the delivery of aged care services. We'll have an opportunity to talk to our partners and have the community talk with our partners as we investigate the implications of this new method of delivering aged care services, and by extension, areas into disability, the impact on HR, the impact on the design-related thinking, and the utilization of resources. So, without further ado, I'd like to start this conversation about the very beginning. That is the modular services design and architecture that we have leading this method and approach into healthcare. So, what do Uber Eats, Deliveroo, and Amazon have to do with the management of patient care? Well, when you look at the way that we consider modular services, we really need to start thinking about how have other industries approached the same problem. And the problem that we're discussing here is one of access and scale. What are the advantages behind this use of modular services and some of the challenges that come as a result of thinking in a modular fashion, which is very different from the matrix or the very large style deployments that we used to see with someone like SAP or other ERP solutions. And finally, we'll round out this discussion by asking, what does it let you do? What does a modular service allow you to do in your organization that you can't do already? So a little bit about us. So my name, as I said, is Grace, and I've come from both an IT and a medical background. In fact, I spent a number of years in both the hospital and surgical environments looking at becoming a little bit frustrated about the inefficiencies around that care. We found that care, the inability to access it, was more about the poor distribution of resources. We saw it as a problem of distribution rather than availability per se of talented individuals. And as we looked further and further, we definitely saw that there were definitely people that were capable of doing it. There were rooms and there were hospitals and theatres that were capable of doing it. It's just that they weren't advertised or scaled or staffed in a way that could actually be allowed an access for other people to have that access. And of course, the person ultimately paying for it is the patient. And insurers, of course, will say that, well, they're the ones ultimately paying for it. But the system's complex enough in order for us to appreciate that the person wearing the, for want of a better phrase, disability, or the person wearing the consequence of it is unfortunately the patient in it all. Now, Aaron and I both have had about 10 to 20 years of experience in computing. I've come from a sales operations and marketing background in IT, where I was helping IDC and some of my clients form strategies around their product. Aaron's come from a complex biological systems, mech-eng kind of background, where he studied diabetes and glucose monitoring for a number of years. He's also a full stack developer, and he's one of the reasons that we've been able to go out and serve as many people as we've had. His design and related thinking has been able to translate into an actual program which we call Mobilio, and we'll be able to explain that as we come up. But first, focusing on you and your business, can you think about how business has been essentially being usual? Like a good example, we were in a discussion with NAB last week, where they presented the fact that if Edison came back into an environment where they were looking at the phone, it wouldn't be very familiar with him. In fact, what you'd have is you'd have this device that wouldn't have any strings, wouldn't have any particular means by which it had an electricity supply attached to it. It'd look incredibly different. And that was really only in a number of decades of development from its initial incarnation. But if you look at something like a hospital, the way that you engage in the business of taking care of a patient really hasn't changed from Florence Nightingale's time. Florence herself would be able to pretty much figure out exactly how the patient and the care would be. There would be some similar analogies to, say, I guess, a military style of operation, and she'd be able to figure out the hierarchy of things fairly quickly. And patients, for a number of centuries, have been going through this process where they present, somebody in a medical position sees them, they're usually routinely or treated and admitted inside a hospital, and that's where the care is delivered. What we're suggesting is that business is going to become unusual, healthcare business, that is, and that's because of a number of factors. But let's first outline our thesis as to how business is going to be unusual. The first thesis is that patients are going to be triaged from a central point, and it doesn't have to be in person. We're already starting to see scripts and consultations being done over Skype. What we're saying is that what might be more efficient is that you have a multidisciplinary approach. And from that initial point of contact, you then are triaged as to whether or not you actually seek higher level care appropriate for a hospital, or that you should be either directed to a local clinic or home for as your disposition for your treatment. And this then means that you're assigned to the care of either a group of practitioners in the hospital, group of practitioners in the home. Pushing that further, we actually think that in the management of chronic and disability associated conditions, you're really looking at even a mid-step where it's neither the hospital nor the home, but these kind of repurposed clinics, which allows you to aggregate services into areas that are closer to the area of need. And it means that you're allowing your footprint to scale. It also means that the referral mechanism and the ability to have multiple people engaged within your clinic increases extensively. Also, your resource, which is your time, your people, and your spaces, are better utilized in the treatment of disability and chronic disease. So we've covered some of these problems here. What we've identified is that the challenges around healthcare these days tends to be around scheduling. That is, it may not even be present if the service is actually even available. It's then hard to navigate the services themselves. So the feedback that we're getting from a lot of the NDIS and aged care clients is that they're not really even sure how first to engage with a service provider, what they're able to access, what they're capable of actually receiving. And all of this is essentially expensive and time consuming. In fact, in a recent HBR article, there was a Greenbelt Six Sigma consultant who calculated that less than 8% of her time was actually effectively spent in treatment, which is a significant amount of taxing, spending times in waiting rooms, and non-productive consultations, not to mention the cost itself to the insurer. If you actually have a serious condition, that can be incredibly frustrating for patients and carers alike. What this also reflects is that at a greater scale, healthcare has been designed to be really siloed. Siloed in the sense of your surgery, your physicians, and your ED. Yes, that's definitely one silo, but the other silos that kind of exist are, well, this is a hospital, that's a clinic, that's a home. Some of the other silos that some resonate with you as an audience is that this is aged care. We only deal with people over 65, or this is pediatric care. We only deal with people under 18. What happens at those margins is really poorly managed, and that really impacts on the way we deliver disability and aged care services. Healthcare is also incredibly reactive at the moment. There is a lot of talk around precision medicine and personalised medicine. The research that is happening now, as has been demonstrated by countless of generations of research that is out there, takes approximately 10 years just to get published with any verifiable and repeatable data, and then goes into the general psyche. And that means that an entire generation of healthcare providers, and I'm not just saying doctors, I'm saying administrators, nurses, allied health practitioners, don't get the benefit of that decade of testing and researching, and that is absolutely necessary that's out there. A proactive approach may be that you think about on a cohort basis, and we'll come back to that later. We also see that one of the challenges with healthcare is that location really matters. And this might be the location of the provider as well as the location of the patient. Where we're seeing the issues around location and provider tends to be one of convenience. If that provider isn't within 5 kilometres or is more than 3 hours drive, the challenges is that patients will go and seek another form of treatment. And that might be alternative healthcare, that might be no healthcare, that might be Dr. Google. And where you're seeing where location matters for the patient, their ability to access internet, their ability to even access technology in order to access these services really starts to matter. So physicality, because I guess at the core of healthcare is touch, physicality, there is a dimension of that can't be ignored. So we opened this conversation by saying, how did the other markets do it? Well, they looked at the level of services out there and decided that they would, ironically, offer a menu of services. That is that they would go out and say, I get that this is your core business. We can do X, Y, Z. And you can definitely see that with Uber, for example. Once they solved the basic transportation issue, they were then able to say, well, what other industries are actually dependent on transportation for its market penetration, for its footprint? Restaurants are a great example. Restaurants in the past, every restaurant had their own delivery network, which was incredibly inefficient. If you didn't make enough in order to cover the delivery guys' pay, then you were taking home less every night as the restaurant owner. In this way, you've been able to outsource the delivery of the food, not have to maintain anyone, not have to hire them, not have to pay workers' compensation if they get involved. And really, the challenge there is that, of course, that risk is then passed on to this delivery network. What you see when Amazon has approached this market, this idea of how can we actually overcome issues of accessibility, location, they have taken what is something very physical, like a book, and actually made it a virtual delivery. And that's where they started. Now they're actually going into something that's more like services, which is a little bit less tangible and requires a certain standard in order to be applied. What Amazon has done there is taken their ability to assess and accredit and brought it into a guarantee. So now they're backing them using their own brand. We're going to see a lot more of that happen in aged care as well. And why is that? Because consumer behavior is actually driving a lot of our industries. In fact, a McKinsey study in 2015 showed that consumer experiences from non-healthcare settings inform the expectations in healthcare. And why that is so is because it sets a standard. It also is a reflection that consumers are incredibly brand sensitive, and your brand is a reflection of the fact that it's a badge of trust. So from the same study, it also says that providers should not take patient loyalty for granted or underestimate the role that experience-related factors such as convenience and empathy play in consumer satisfaction and loyalty. With increased market competition, people have more choices, and in fact, changes in the Australian government's approach to healthcare funding and disability care funding mean that that's exactly what they're trying to give. They're trying to give more choices with the anticipation that this will drive consumer satisfaction. The idea is that providers now have to consider factors like convenience, like empathy, in order to actually engender things like consumer satisfaction and loyalty. And don't assume that just because you own the data or you own the customer's details that you actually have any particular game leverage. There is plenty of technology that's being developed out there, both at a startup level and at an incredible international level, that's actually anticipating this patient's transferability between providers. They'll be coming in a future LinkedIn and webinar presentation. Finally, I wanted to bring up something else that McKinsey found in its concluded in its Consumerism Myths document. It's pointed to the fact that there's a rising trend for convenient locations, accessible convenient locations. And really that trend is towards taking healthcare out of the traditional modes of delivery, like hospitals or like home, and really putting them into retail style environments like pharmacies and clinics. That allows them in order to have access to established social conveniences like shopping centres and parking and buses and transport routes that aren't necessarily as part of a design of the local multidisciplinary clinic or even the local hospital. The challenge here is that consumers are going to seek the opportunity in order to seek healthcare wherever is most convenient for them. Those people that are not online will have an ability to engage with people for maybe the next decade in the same manner. If you can do your diary on a book, that's not a problem. If you have a secretary that's taking phone calls in order to book your appointments, that's not a problem for the next maybe 10 years. Unless, of course, you're in our North American audience, and really you've only got about 5 years left on that style of business. What's happening is that as the next generation of baby boomers, of people that are coming through, the generational difference is that they expect the convenience of IT-enabled systems. And what they're looking for are providers that are able, in order to ensure that they can access healthcare at any time. Great accessibility. So how does this actually relate to modular services design? Well, as Michael Masalowski, one of the business futurists that was available, that was speaking at CeBIT this year, he listened to what we had to say about a modular approach to healthcare, and he said, this is the future of business. So I'm excited to share this with you. We've talked about the healthcare problems and how a non-modular thinking to healthcare doesn't address these problems. And here's a good example of the consequence of a matrix style assessment of a business. What happens is that this might be your typical hospital network or a private healthcare network where you have main facility staff, clinic staff, and some mobile staff that go out and do community outreach. And in total, you have about 38 staff. Now think about it as functioning across a virtual environment. What can this virtual environment suddenly do for you? Well, what's examples of some modular styles of approaches? Well, let's say assessment is a module in itself. Cleaning is a module in itself. Checkup is a module in itself. In this, you'll understand that modular services are those services that can be discretely packaged and function independently, providing an output to the business as a whole, after receiving a certain sets of inputs. So in fact, internally, you can actually assemble assessment in any particular way. Notice that it's not like the VP of finance as a matrix, but it's more like the CEO of assessment or the business unit of assessment in itself. And unsurprisingly, this is how people like Amazon have gone out and actually assembled their businesses much more functionally. They call it a modular services architecture or microservices architecture, where one particular function is owned by a small team, a team that can be served by no bigger than, can be fed by 2 pizzas really, to quote Jeff Bezos, that are responsible for the interface, so the input, the output interface of that particular function. And then within it, it's a simple understanding within a small team, right, of designers and developers that understands how that functions within it, almost like a black box. So in this case, inside a hospital, this assessment, cleaning, and checkup modules can actually function over a number of different areas, thus giving it flexibility and resilience. The idea is that you can then take your staff and move them across these different areas, thinking about them as part of an actual functional unit, rather than the focus on how they're delivering the service. Think about the actual function. The module actually becomes more important here. So when we look at our healthcare approach, the idea is that you can then deliver the healthcare in any of these areas and overcome some of the challenges that they actually have. You can provide useful services in the vicinity of these patients and can offer flexibility and efficient delivery of that healthcare. So the combination of Medic-Rooms and Mobilio allows you to empower your staff and patients to access the existing services, perhaps those that are actually being underutilized in your own business. It provides a simple mechanism for navigation, and it allows you to efficiently and with enhanced features schedule these patients and perhaps even your own treatment plan if that's how it's being used inside your organization. I'll quickly take you through how Medic-Rooms works. Medic-Rooms is like the Airbnb of medical rooms, really, for doctors and other healthcare providers. We find available clinical rooms and we match the surgeons, physicians, physiotherapists, allied healthcare providers that want to use a room on an ad hoc sessional basis. And this allows them to reduce their operating costs. It also allows them to increase their referral network and increase their footprint. What it also allows them to do is to So take all the mess around hiring a room or owning a room and move it off to somebody else. Outsource that problem and let it be managed by somebody else. So our platform allows the advertising, bookings, legals, it all handles all of that aspects of it, as well as it automatically generates contracts, payments, and offers additional services packages. It's a really beautiful, simple interface that allows you to see what available rooms are there and what they look like, and see the sessional rate for them. Our second product that we're talking about to help you deliver modular services is Mobilio. Mobilio takes the idea that beyond bricks and mortar, you have distributed mobile and virtual means of engaging with your patients. And this allows you to increase your footprint, it allows you to increase your base of patients, and also allows you to save things like travel time and essentially unallocated labor, or unproductive labour, where the patient is not really engaging with a healthcare services practitioner in a way that can actually be compensated by the system. Because we focus really on the ability to have simplified and elegant scheduling, what you're seeing here on the screen is an administrator's view. They're able to see where their resources, such as these two doctors here, where they are within the week, how well they've been allocated, where they've been allocated. And the great thing about this system is that it can automatically then generate a website in order to allow patients to book in with those particular practitioners. This can then be hooked up with a calendar invite or a payment system, as it has been done here for one of our clients here in Melbourne. And the great thing is that you can allocate inside their distributed clinics. You can send your resources or your staff across to mobile care units. You can also assign them to virtual care engagements as well, all using the power of this scheduling platform. So that's how Medic Rooms and Mobilio together can allow you to start modularizing your care. It will allow you to take a function like assessment or clinical checkups and allow you to push that staff out across clinics, distributed clinics, mobile health assessment units, or home visits, or even virtual engagements, all using that same kind of technology and all boxed within that certain area. So once you have a discrete function like that, the flexibility then becomes you can start moving your resources more efficiently around the organization. It also means that you're no longer dependent on just one type of business model. We've definitely seen in aged care the risks of having one particular type of business model driving your business, and the market vulnerability associated with it, especially of any criticism that occurs or any other entrants that come in and compete against that style of business. What we'd like to talk about is empowered enhanced healing. And what we can see here is this lady has this 72-year-old lady who's got diabetes and osteoarthritis, called Betty, has come in seeking opinion from her care provider. She's taken an hour-long journey in order to come in and see her. Hip sore, difficult to park, difficult vision. She's found it really challenging in order for her to actually seek any advice in person. The challenge also is that technology really isn't her friend at this point in time. How can we actually assist her? Well, using our technology, you can integrate assessment devices such as this one here, Sophie Hub or Amazon Alexa, that allow people in order to have a tracked movement around their house. Should any fall occur, then care providers in the area can be contacted, or the local resources like a surgeon or a GP can actually be sought out through using the Medic Rooms platform. And surgeons can then create this virtual environment which they can seek and see patients. And the idea here is that then this expedites this patient's review into a hospital treatment or, as appropriately, home treatment. Should they need surgery, our platform can also assist in aggregating the team and calling them into an environment where they're required. And for faster discharge home, we can associate them with a whole team of in-home care that would have otherwise been delivered in hospital with expensive hospital bed stays. So the power of this B2B platform is that it allows you to see the resources that you have out there, see their utilization, and better release them back into an environment that might mean that they're used for profit, used more efficiently, or used for the betterment of access. It allows one simplified coordination view. And it means that you're able to scale your presence across multiple locations. If you're already across multiple locations, this modular style approach to factoring your functions allows you to scale and manage across these multiple locations more efficiently. So the takeaways from this discussion are: make sure that when your patient engages with your organisation, offer a menu. Let them see the drop down. Let them see where you're going to be. Let them see where the nearest location is for them. Give them a choice. Have a proactive means in which you engage with your patients. Let's allow them to say, I actually feel like I would like to see my diabetic educator over the phone or in person, or have a virtual consultation on Skype, or go to their clinic nearby. That can, if it's under a modular services architecture, that all falls under the one banner of assessment, and let that module sort that out, because a system like Mobilio and Medic Rooms has been assigned to enacting that particular function. And make sure that location doesn't matter. After all, accessibility and convenience is really something that consumers are looking for. And if you are virtual, you've also got some degree of distributed, or you've got a bricks and mortar, you're using a system like Mobilio can allow you to actually extend out those particular networks, increasing your coverage. So we'd love to have a talk with you about your people, time and spaces, and how you're offering a menu, how you're being proactive about your services, and how you're ensuring that location doesn't matter in the delivery of your services. Thank you so much for your time. And if you have any questions, I'd like to get you to email them to me at info@perioppartners.com.au. info@perioppartners.com.au. My name is Grace Light, and I thank you for your time today. Please join us for our next webinar.